An effort to better inform the African American community about the vaccine, Bishop T.D. Jakes brought in big-name experts for an online event called Conversations with America, Understanding the COVID-19 Vaccine. During the nearly hour-long discussion, Jakes asked questions such as whether these experts had any angst about the vaccine over the long term. Dr. Kizzmekia Corbett, the lead scientist on the coronavirus research team, didn't hesitate.
Absolutely no angst at all. You know, one of the things that I think is largely forgotten throughout this is that the first phase 1 clinical trial actually started on March the 16th, which was almost 10 months ago. And so from those people, they've been followed since then, and there are no outcomes for long-term adverse outcomes. Long-term side effects are not something to be worried about.
Much of the concern among Blacks dates back to the Tuskegee syphilis experiment, a 40-year government study involving hundreds of Black men. The men, mostly poor sharecroppers suffering from syphilis, were monitored yet not treated by government health officials. Many died, went blind, or experienced other severe health problems. Dr. Anthony Fauci admitted the skepticism is understandable.
It's a shameful history that we have to just deal with. So whenever I talk to my African American friends and colleagues about getting vaccinated, you always have to show respect for their skepticism and then try to get them to understand why it is safe, it is effective, and it is good not only for your own health, but for your families and your community.
Jakes explained while hard-hit communities of color desperately need the vaccine, access and distribution may be a problem. He suggested using churches and other faith-based groups as a solution.
Is there any thought about getting medical professionals to work through faith-based entities within those local communities where they could go to churches, for instance, and have medical physicians there that could administer the vaccine? Because many of our communities are in food deserts and places like that where they can't get the vaccine.
You could do it by community centers, churches. You mentioned, Bishop, is very important. Faith-based organizations getting involved, but also mobile units to go out into those communities which are not readily accessible.
In the meantime, Jakes says while his conversation provides people with education and knowledge about the shot, he also wishes to offer hope to those affected by the pandemic. Charlene Aaron, CBN News.